And get started. Thank you everybody for joining today's webinar, Emotional Side Effects of Cardiomyopathy in Teens, Depression and Anxiety. My name is Susan Hepworth. I'm the Executive Director of the Children's Cardiomyopathy Foundation, and I'll be hosting today's webinar. I am pleased to be joined by Dr. Jami Gross. Jami is a pediatric psychologist and Associate Professor of Pediatrics at the University of Missouri, Kansas City. Before we get started, I did want to take a moment to remind everybody on today's webinar that September is Children's Cardiomyopathy Awareness Month, and that's an opportunity for us to raise awareness amongst the general public about what is cardiomyopathy, what are the signs and symptoms people should look for, and how it is that we can support those who are affected by cardiomyopathy. So my colleague will be pasting into the chat here in just a moment a link to learn more, but we did want to let you know that through September and even beyond September, really before the end of the year, the signature event of Children's Cardiomyopathy Awareness Month is our Walk for a Cure. So that's an opportunity for you to organize a walk in your own community with your own family, friends, colleagues. You can even have friends and family participate with you in another state. They can walk at the same time you are. But we would encourage you to learn more about that by clicking on the link that's in the chat, organize your walk, and help spread awareness about children's cardiomyopathy. So with that, I'm going to stop sharing my screen. I'll invite Dr. Gross to share hers, and she can go ahead and get started.
Great. All right. Susan, is that the correct slide? Are you seeing?
Well, it's in the presenter mode again.
Again? Oh my goodness. All right. Let's see if we can switch that up. Is that better?
Nope, it's still presenter.
Oh, I just swapped it and it didn't want to. All right. Go back. Okay. Well, the one thing that worked for us earlier is not working now. So I think we may have to just keep it in presenter.
That's fine, whatever. Yep, no problem.
All right. Well, thank you all for joining us today. I'm so grateful to be able to be here and talk to you about some of the impact of cardiomyopathy in our teenagers on their emotional well-being. And so we are going to talk about depression and anxiety, but we're going to expand that a bit and talk about some of the other impacts we see on emotional well-being as well. Just a little bit of background and personal information. I have no financial disclosures or conflicts of interest. And I always think it's helpful for you to know a little bit about who's talking to you. And so background on me, I am a mother and a wife. I identify as a Caucasian female. I'm from the Midwest and currently work in the Midwest at Children's Mercy in Kansas City. I am a psychologist in cardiology and have a specialization in heart failure and transplant, and also have a cousin who had cardiomyopathy. I think it's helpful for us to start with a bit of a roadmap so you guys can follow along knowing what we're going to talk about. So we're going to start with why cardiomyopathy impacts well-being in teens, adolescents, and young adults. We're going to speak about some of those specific effects that we see in our teenagers. We'll touch base on when we should worry about teens and what to do if we're concerned about a particular child or adolescent. And then I'll briefly review a few resources that are out there if you're looking for more. So adolescents in general have a whole lot of jobs that they have to do during that developmental phase. They are in the process of early identity development, figuring out who they are and who they want to be. They are expanding their social relationships and really building deeper connections with their peers, their family, and others. And they are also trying out new ways to be autonomous or try to do more things on their own. And those are all really cool things for them to be doing, but it makes it really difficult for them when we add in an underlying cardiomyopathy or other health condition. So we see that cardiomyopathy can really have an impact on just normal teenage life. We see teens already comparing themselves to peers on a regular basis. And when you have a chronic health condition, that's one more thing that may make you feel different from your peers. Teenagers have a lot of responsibilities. And during this time that they're trying to be more independent, we want them to brush their teeth and put on their deodorant and finish their homework and get and stay organized in the activities that they're doing. So when we add in the responsibilities related to a heart condition, such as medications or drinking more water or managing activity restrictions, those are responsibilities on top of the things that their peers are already being asked to do. They may experience time away from school or home or activities that they enjoy, whether that's just for clinic visits or because of illness or hospital admissions. We can see the impact of some medications on mood and physical symptoms that make them more tired and things like that. The physical symptoms of cardiomyopathy themselves can really impact overall well-being. If we feel tired a lot of the time or fatigued or can't keep up with our peers in the same way, that can start to affect emotional well-being also. Now, activity restrictions are a difficult one, and I see that next webinar is actually looking at sports participation in our hypertrophic cardiomyopathy patients. And I think that's so important. Now, for some of our teenagers where activity and sports aren't super important to them, we may see this impact them less. But for those kids who are really involved in sports, really would like to be, or that's their normal friend group, having activity restrictions can really impact that identity development. As we all know, cardiomyopathy comes with a very wide spectrum of the course and the outcomes. And so that leads to a lot of illness uncertainty in teenagers. They don't necessarily know what to expect from their particular course of cardiomyopathy. In some, they may have family members that have had really great outcomes or much more complex outcomes, and they're trying to figure out what that looks like for them. Along with that comes a fear of death that isn't necessarily different than some other conditions, but the fact that the future is a little bit unknown for their particular course can exacerbate this fear. And then parental overprotectiveness. We know that kids with chronic cardiac conditions, not just cardiomyopathy, very often have parents that identify as a little more overprotective than other parents. And this is really by design, right? When you have a child that needs to take medications and monitor their health on such a regular basis, it's really important for parents to be a bit more involved, to follow along a little bit closer on a daily basis with what's going on. But we do see that can impact kids as well, causing a little bit more anxiety from time to time, or a little bit less self-confidence in what they're capable of doing on their own. So we're going to switch gears now and talk about what are some of those impacts on emotional well-being that we see in teens with cardiomyopathy. And the first one I wanted to talk about is quality of life. And I really wanted to talk about this because it's something that a phrase that we tend to use in healthcare often, but we don't often define what it actually means. So quality of life, if you look at a dictionary definition, is the standard of health, comfort, and happiness experienced by an individual or group. What this really means is that quality of life is how a person's health impacts their social, physical, emotional, and spiritual well-being. So what does this look like in teens with cardiomyopathy? We know from research that's been done that teens, at least with dilated and hypertrophic cardiomyopathy, have a poorer quality of life than their healthy peers. And we can assume that this would likely be true for other types of cardiomyopathy as well. We also know that when teens fill out a survey where they're answering questions about their quality of life, and we compare those to the survey completed by their parents, there's often a lot of differences between those two reports. And what this tells us is that it's really important for us not only to ask the teen or not only to ask the parent about some of these issues, but to make sure we're hearing information from both and pulling that together to move forward. We do know that teens have a worse quality of life than younger kids with cardiomyopathy. And then, as often is the case, even though we know that kids aren't just little adults and that things look very different for them, sometimes we don't have as much information and as much research on cardiomyopathy in kids. And so we have to pull a little bit of what we know from the adult literature. And so we know that in adults, risk factors for worse quality of life in cardiomyopathy include women having more severe heart failure or heart symptoms, cases where there are not other family members that have cardiomyopathy as well. And then at the older that we get, the worse quality of health-related quality of life we have. Next, we're going to talk about depression. So we think about depression as this combination of symptoms that may include hopelessness, sadness, inadequacy, poor energy or sleep, poor appetite. It may also look like withdrawal. So kids staying in their room a little bit more than we would expect, which we all know teenagers do in general. Agitation and anger, lack of interest in activities that they used to enjoy, sadness, a lack of focus on the future. So this may be a teenager saying, you know what, I'm not even going to take the ACT. And so symptoms or signs like that can start to make us think about maybe some symptoms of hopelessness that are coming out in different ways. Now, there is a difference between a diagnosis of depression and someone experiencing depressive symptoms. That being said, we don't have to have an official diagnosis in order for those symptoms to be problematic and something that we want to try to improve. So what does this look like in teens with cardiomyopathy? We know that depression is more common in teens with cardiomyopathy when we compare them to their healthy peers, at a rate of 29% in the cardiomyopathy group compared to about 8 to 10% in a normal healthy population. We know that depression or depressive symptoms are more common in teens than younger kids with cardiomyopathy. And this is true for adults as well. We don't see a big difference between teenagers and adults in terms of rates of depression. And we know that depression can actually not just be problematic because of the symptoms that are presenting, but it may also impact adherence to medical treatments. So we're going to talk just a little bit about adherence and non-adherence in a few minutes, but I want to start to infuse that in the areas as we talk where it may come up as an issue. And depression and lack of motivation is definitely one of those areas where we can see that impact. So next up, we're going to talk about anxiety. Anxiety is this state of excessive uneasiness or apprehension. Sometimes we may see panic symptoms. Sometimes we may see compulsive behaviors, like things that we feel like we need to do over and over in order to minimize or make our anxiety better. And those panic symptoms become especially problematic in kids with cardiac conditions because panic symptoms often feel like a high heart rate or like a pounding in your chest or difficulty breathing. And so those often mimic some cardiac symptoms that can really make us and make the teen feel very anxious. Anxiety can also come out as an inability to start or engage in tasks that they need to do, or an avoidance of anxiety producing situations. There are all sorts of coping styles out there, and you guys may have seen these at various times. But one thing we know is that teenagers are great at avoidant coping, that they do a really good job of just pretending that an issue doesn't exist in order to feel better about it and try to not have to deal with the stress associated with it. So there are several types of anxiety disorders out there. There's general or generalized anxiety disorder, which does not necessarily have a specific trigger, but is just a general feeling of discomfort and uneasiness. There's social anxiety, post-traumatic stress disorder, obsessive compulsive disorder, and others. And similar to depression, you can have an anxiety disorder or you can have anxiety symptoms that don't necessarily meet all the criteria to have a diagnosis, but are still problematic in day-to-day life. So what does this look like in teens with cardiomyopathy? We see anxiety, again, at a higher level in these teens than we do their normal healthy peers, a comparison of about 20% in the cardiomyopathy group to about 8 to 10% in normal control group. We also know that anxiety is more common in adults as well, even more so than it is during those teenage years. So we see that that increase in anxiety symptoms tends to continue over the course of the lifespan, with females experiencing more anxiety than males. And this can really impact engagement in care. So if my heart condition is concerning to me, then I may avoid thinking about it. And taking medications may make me think about it. So I may avoid taking my medications as well. Now, behavioral concerns. We all know what these look like. It may come out in so many different ways, including acting out, talking back, intentionally defying what our parents or teachers would like us to do. It may even be destructive behavior. But we know that teens with cardiomyopathy don't actually demonstrate any more behavioral concerns than their healthy peers. Now, that does not mean that as parents, you don't see behavioral concerns in your teens, and most likely many of you do, but they may either be similar to what their friends and their peers are experiencing, or they may actually be a sign of some of the other things that we've already talked about. So we know, for example, that depression can often come out looking like anger, agitation, especially in teenage boys. And so what we may see as a behavioral concern, being disrespectful or talking back, may actually be a symptom of one of those other internalizing issues that we've discussed. It may also look like non-adherence. All right, next up, we're going to talk just a little about neurocognitive concerns because there's such a big overlap between depression, anxiety, quality of life, and some of these neurocognitive issues. So when we say neurocognitive concerns, what we're talking about is problems with things like learning, paying attention, remembering, or even academic or school performance. One of the common neurocognitive issues that we talk about is something called executive functioning. Now, that's a term that I think we kind of toss around a little bit more than we used to. So it's helpful to know exactly which skills we're talking about. And executive functioning includes working memory, flexible thinking, self-control and emotional control, as well as inhibitory control, which is holding back our impulses when they're not appropriate, and then also planning and organization. Now, you may be thinking that your teenager is really bad at a whole bunch of these things, and that's actually very normal. So executive functioning skills tend to be housed in the very front part of our brain. And that part of our brain doesn't finish developing until typically in our early 20s. And so we don't expect that most people are going to master most of these skills until they get into that young adulthood phase. So what does this look like in teens with cardiomyopathy? We tend to see worse executive functioning when heart function worsens, and specifically worse left ventricle function and worse cardiac output. We know that when someone is not good at things like planning and organization and memory, it can really impact how they take care of themselves. We also know that at least in adults, cardiomyopathy is related to poor sleep quality. And we all know that if we're tired, we don't think as well. Our memory's not as good. We're not as attentive to the things we need to do. So it's possible that some of the things we see in teens who are showing some neurocognitive concerns may be at least partially related to poor sleep. We also notice that executive functions may be something that we don't see a whole lot in those younger ages because what kids are being asked to do at 5, 6, 7 isn't requiring as much of them. And so if one particular teen has more problems with executive functioning skills than another, we may not see that in those older years. If I ask a 5-year-old to pay attention in kindergarten, we're probably only going to ask those 5-year-olds to pay attention for maybe 15 minutes or so. As that 5-year-old gets older and goes into middle school and high school, and we're asking him or her to pay attention for an hour at a time, those are the times that we're going to start seeing, oh, wow, they're still only able to function and pay attention for that 15 minutes. And so it's not that executive functioning skills necessarily get worse as kids get older, but what's being asked of them requires more, and we start to see those deficits. But I will add in the caveat here that we know very, very little about what types of neurocognitive concerns we see in kids and teens with cardiomyopathy. Most of the research that has been done has either been in congenital heart differences or in the post-transplant phase. So non-adherence, I could probably talk about this all day. It's a whole nother talk in and of itself, but I do think it's important because of the overlap to talk a little bit about it here. So non-adherence is when a patient does not follow through with the recommendations from a medical provider. Now, we may sometimes hear the term medical compliance thrown out, and my team here at Mercy knows that if they use the term compliance, I'm going to correct them every time. And the reason for that is that compliance implies that somebody is on purpose going against what was recommended by their medical team. And we know that non-adherence is not always intentional, and that very often it's not intentional. In the general population, adults, kids, and everything in between, about 40 to 50% of patients demonstrate some non-adherence to the medical advice from their medical team. This costs healthcare and the healthcare system about $100 billion per year, which is a pretty huge number. And this is just for people with chronic health conditions. That number is a whole variety of factors, including disability, including repeated admissions that wouldn't be necessary if adherence was better. It may be more emergency room visits or prescriptions that are left unfilled. And we know that non-adherence can be impacted by multiple factors. So depression and anxiety, as I alluded to earlier, are both things that can really have a strong impact on whether or not a person is able to engage in the self-care required to stay healthy. We know that cognitive ability can impact non-adherence. If somebody doesn't understand the recommendations that are being given to them, it's much harder for them to actually follow through. So my favorite example of this, I worked with a young man many years ago now who had diabetes. And he was repeatedly being admitted to the hospital because he was not managing his diabetes well and was having some negative side effects. And this poor young man was just distraught because he really felt like he was doing everything he was supposed to do. His parents were frustrated with him. And as we sat down and talked more, we realized that he had a learning disability in math. And even though he was attempting to calculate how much insulin he needed, and he was attempting to count carbs and do all of the things that his doctors had said, his math was wrong. And he was not always doing it accurately. So we were able to identify that and then come up with some new interventions and a little bit more guidance from family to help with that process. In addition to cognitive ability, sometimes language or understanding of healthcare jargon gets in the way of us doing what our doctors ask us to do. So what does this look like in teens with cardiomyopathy? There's actually very limited information on how adherent teens with cardiomyopathy are. We do know that about 1/3 of teens with chronic illnesses in general demonstrate some non-adherence, and that this number is the same following a heart transplant. So we can assume that teens with cardiomyopathy probably aren't super far off from these numbers. And I have to tell you that 30% following heart transplant makes me a little anxious and gives me some palpitations as well. When teens are non-adherent to their healthcare team's recommendation, it can obviously impact health. It can impact family dynamics. If any of you have ever had to harp on your teen to do anything that they were supposed to do that was really important to their health or to their life, then you kind of know what I'm talking about. It can also impact things like transplant candidacy in the future. However, just like adults who fall in that 40 to 50% of non-adherence above, with teens, it's not always that they are intentionally trying to go against the medical recommendations. Teens are involved in a lot of different things and they're trying to learn to be independent. And sometimes If they actually feel pretty good from a health standpoint, they're taking their medications may not be their highest priority, even if it's yours, and even if we think it should be higher. So they may forget, they may avoid taking meds because they don't want to take them in front of their friends, or they don't want to leave an activity to have to go home and do what they need to do from a health standpoint. And they may lack the initiative or the planning and organization to be able to manage their healthcare needs effectively. All right, so we've talked about some of the specific things that make us worry or that we should keep an eye on in teens with cardiomyopathy. So now we're going to talk about where is that tipping point when these are just normal things that teens are experiencing and will work through versus a time that we really need to start worrying about them. And my general rule with all of these, whether a child or teen has a health condition or not, is that when emotional symptoms start impacting daily functioning, that's my first red flag. If kids are late to school every day, if they're not doing the things that they love, if they're not able to complete the things that they need to do to live a successful life, that's when I worry. If those emotional symptoms are starting to impact physical symptoms, whether that's through anxiety or non-adherence or some other form, then we need to pay attention. If we see our teens withdrawing from their family or friends, or no longer being interested in the things that used to be fun for them and used to bring them joy. Changes in school performance is one sign that if you're seeing things that worry you at home and your teen isn't doing as well in school, that we're starting to see those symptoms come up in more than one area of their life. And maybe that means we need to pay more attention to it. If your teen expresses feelings of hopelessness, or if they ask for help, my hope would be that we would automatically jump to moving forward and doing something about the symptoms that they're reporting. So what is that something? What do we do when we're concerned about these teenagers or adolescents? The first one is to talk to your teenager about it. Sometimes we worry that talking about mental health, and especially talking about things like suicide, might actually worsen symptoms. And all of the research that we have tells us the exact opposite, that when we initiate those conversations, that it opens the door, it helps them feel more comfortable. And maybe they'll be willing to talk about the things that are bothering them in a little bit more open way. Encourage your teenager to be an information seeker and to learn more about what's going on in their life, both their cardiomyopathy as well as any other things that might be happening. There was actually a really cool study that came out looking at adults with cardiomyopathy and comparing the ones that went to medical websites to seek more information and those that did not seek information in that manner. And those who sought out more information on medical websites actually demonstrated fewer anxiety symptoms than those that did not. We are all inherently people that want to know what's happening and want to learn more. And so being an information seeker can help. Give control where appropriate. Now, this is hard, right? Because if you give your teenager all the control over their healthcare and they don't follow through, then that's going to be problematic. But that's where, as parents, we can step in and be the safety net and give them some control about timing of medications, or allow them to try to remember and set their own alarms. But we come in on the back end and double check things. Talk to your pediatrician or cardiology team. So many of the cardiology teams out there are going to have psychology or social worker at least accessible if you have concerns. Some of your doctors and medical teams may have screenings in place where they're already monitoring emotional well-being, or where they can jump in and kind of help you look into what might be going on. Often kids look a little bit different in terms of their behavior or emotions at home and at school. So I think it's always helpful to get information from the people at school about how they view what's going on with your teenager. If you feel like you want to seek out therapy or counseling services for your teen, or even psychiatry services, I always say the best place to start is to call your insurance and ask what counselors are covered under your insurance. Because you may get some really great referrals from your medical team and from people that you know in your community, but you may then hit a standstill if none of them take your insurance. So this is a really great place to start. And then my one caveat, at any point, if you're concerned about your teen's safety, seek care immediately. You can go to the local emergency room or call 911. If you feel like your child needs more intensive help due to mental health or safety concerns, you don't always have to go to your local emergency room to seek those services. You can call or just go to a local mental health hospital that you feel comfortable with. And then I just added on here a few resources. I feel like sometimes these resources, especially in the era of COVID, are kind of hard to come by, but I also think that all of this virtual work that we've been doing is maybe expanding them to some extent. This first one is a support group. It's specific to kids with ICDs, and so I know that doesn't reach everybody here, but I do think it's still it's a great resource for those that fall in that category. MendedHearts.org has some really awesome resources for support. Obviously, our CCF Family Resource Center, and then the Adult Congenital Heart Association. If you haven't ever looked at their website, they have some really awesome resources, not just talking about some of these things that we've talked about today, but also looking at resources for transitioning into the adult healthcare world, which again is a whole nother topic of conversation. But those resources are pretty cool, and a lot of our patients here have really found them beneficial. And with that, I am going to stop sharing my screen and open things up for discussion or questions.
Sorry, thank you so much, Dr. Gross. That was very, very informative. Love that. So we've gotten a few questions in so far. Would remind everybody that we've allotted time here at the end for question and answer. So go ahead and click the Q&A button at the bottom of your screen, and you can type in that question and I'll be able to ask it of Dr. Gross. So our first question is, what quality of life inventory or assessment tool do you recommend for children with heart failure and/or cardiomyopathy? Do you routinely use different tools at different ages?
So the PEDS QL it was developed by Wallander and Barney. And the really cool thing about that tool is that it covers a huge age range from very early childhood all the way into young adulthood. And it can be completed by younger children once they're able to read, all the way up into, and can also be completed by parents. And so you get that comparison of parent and child report that we talked about. The other nice things about that particular measure is that it's been translated into, I don't even know how many languages at this point. I believe it was over 30 last I heard. And so we can look at that in a wide variety of populations. And then there are specific measures within the PEDS QL that are for heart failure and transplant. There's actually a VAD one at this point. And so the PEDS, and they all compare really nicely across each other. There's a very generic scale that some people use. We do use that in our VAD patients on a regular basis. We have used it in a few different research studies that we're doing in some of our heart failure patients as well. And so it's not something that we do every year, but that is actually a quality project that we're undertaking soon.
Okay. So Dr. Gross, this is kind of a follow-up. Somebody else says, could you expand on why quality of life is lower for non-familial cases and women?
Yes. So I'm actually really glad somebody asked that question, because when I came across it in the literature, it was something that really stood out to me, and I tried to dig a little bit deeper into that. So I can tell you that we don't have an answer supported by research yet, because I have not been able to find it. I can tell you what some of the hypotheses are, though. And what I think is probably going on, and what I've seen in some of the literature, is that in cases of familial cardiomyopathy, kids get to watch how their parents continue to live their life, even with this chronic health condition. They may see them going to work and obviously having children and doing normal things. And so that modeling of that, I think, is a really great way for them to see that they can continue to engage in those daily life things. Whereas kids who don't get to see that in their home, or they don't get to see that in other people that they know, and they don't have a frame of reference, that we may see more of an impact on those kids. Um, as far as women, I can tell you that it's a pretty common thing that we see across the board, that we tend to see more internalizing symptoms like anxiety and depression in women than we do in men. We may not actually see more, it's how we measure it. And so we may be measuring those symptoms a little bit more in women.
Okay, we've gotten a lot of really good questions in. So the next one is, what can I do now? My son is age 6. What can I do now to prepare for the challenges of cardiomyopathy ahead?
So you're already doing it, right? You're thinking about these things ahead of time and you're gathering the information. So I am a huge proponent of having really open communication with our kids. My kids are now 8 and 10, and we've always had really open communication. Sometimes that backfires on us to some extent, but I think that's especially true in healthcare, because the research that is out there looking at how we communicate with kids about their health conditions tells us, number one, they want to know more, and they want us to continue to teach them as they grow. And it also shows us that they are going to come out and ask for things if that door is open. So they're going to guide how much information they're capable of taking in. So if you're talking to your child and you're explaining what their heart condition is, and they start to tune out and they start looking down at their phone, or they turn away, or they stop asking questions, then they've probably hit that point where they're done for now. But I think it's really important, starting as early as 6, to start giving some information about their health condition, and then giving them tools to have some control over it. So, hey, let's start learning what all of your medicines do. Or let's start helping you talk directly to your doctor when you go into the office. And so giving some of that control early on is great. And then finally, developing coping skills early on, I think, is incredibly important. And having skills to manage anxiety and stress from an early age can only help us as we get a little bit older. So I do a lot of mindfulness teaching in my patients that I work with. And many of my patients don't actually meet criteria for anxiety or depression, but they're starting to have symptoms, and parents are seeking out care to help with those things. So we do a lot of mindfulness, mindful meditation, mindful awareness, body awareness. And part of the reason that we do that is because it helps us manage our stress better, but it also helps kids to really get connected to what's happening in their body. And so they are more aware of when something feels different and what might be stress versus an actual cardiac symptom.
Great. Okay, we got a few more questions. Do you see depression and anxiety following post-transplant kids from preteen through their teen years? Or do you see them handling it better as a teen since they've been living with it prior to becoming a teen?
So that is a really complicated question. Doesn't mean I'm going to avoid it. I'm still going to answer it, but it's incredibly complicated because that time in life is so complicated. I will say that for patients that have known about their cardiac condition for a long time before they move into that heart failure and transplant time, we do see that those kids do a little bit better on average. We definitely have some of them that still concern us. The ones where I see more acute depression and anxiety are the kids that maybe did not have their cardiomyopathy diagnosis much time prior to the need for transplant listing. So I do think that knowing about it early definitely helps. I think the other piece that's complicated here is that normal, healthy peers that don't have to go through any of these things also have higher rates of anxiety and depression. And so sometimes it's hard for us to parcel out, are these things that we would have seen without transplant or without worsening heart failure, or is this just a normal part of their development as a teenager. And unfortunately, we have transplant on top of it. So it's hard for us to know, but I definitely believe that those kids that had time to adjust to their health condition before they had to adjust to needing a transplant do have a little bit easier time coping.
Okay. I think we've got two more questions here. We say thank you for sharing all of this information. Early in the webinar, you mentioned being patient with my kid that has cardiomyopathy when he acts out and when it's hard for them to watch their friends go faster and be stronger. Is there anything I can do as a mom to help his friends understand that this medical condition affects him daily?
So I think this can be a tough one for some kids because some kids are going to be very private and they don't want their friends to know as much. And others really feel better when their friends understand and can comprehend what's going on. So the first step in that is to sit down and talk to your child and say, hey, sometimes your friends can be really helpful about these things if they know what's going on. And so maybe let's sit down and talk to them. And that's going to look a little bit different at every age. I have had some schools where a child or a teen has had maybe an event that happened at school. And so part of our education and support process for the school is talking to them about cardiomyopathy or whatever the condition was and how that may affect a child. I've had some parents that sit down with the teacher at the start of every school year and that they provide some education to the class. And then I have kids that say, I don't want my friends to know. I don't want to talk about this. And I think it's really important there for us. We can still encourage and we can still prompt, but I think it's important for us to respect that. There's been cool research that's come out about putting a child in a classroom who maybe looks different from a medical standpoint. And they compare classrooms where they tell the kids what's going on with that child to classrooms where they just put the child in and they don't explain anything about the differences. And in the classrooms where they've explained the differences, you see that all of those kids report they want to be friends with that child. You see more empathy when you observe that classroom. Whereas in the other class where they didn't explain anything, those children tend to be ignored a little bit more and have more difficulty engaging with friends. And so that tells me what many of us know, which is most kids are pretty good at heart. And that when we give them information, they can usually handle it and use it to develop more empathy and be better friends.
It's really fascinating, Dr. Gross. Okay, just one more question. This person says, breaks my heart to see my child struggling with these things. Have you seen the practices you've outlined be successful? I'm sure you probably have. As teens transition to adults, have you seen improvement in their mental health naturally?
So that's hard because we don't always get to see them once they transition into the adult world, right? But we do follow up with some of them and we do get to know some of that as well. The teenage years are hard regardless, right? I'm pretty far removed from mine, but I remember it being pretty complicated and I'm sure we all can. And so most of us got through our teenage years, transitioned into the adult world and hit bumps along the way and really ended up doing okay. And I think that's probably true for a lot of kids in general, that if we do nothing to like adding in counseling or some of these other resources that we're talking about, the large majority of kids, even with cardiomyopathy, are going to stumble into adulthood and end up being okay. That being said, we don't always know which ones are going to have more difficulties as they go. And if we have resources that we can provide that makes that an easier process for them, I think it's really important for us to utilize them. We do know that the young adult time period for kids who are transitioning into the adult healthcare world really is pretty complicated. And we do see more anxiety and depression in those young adult years than we do sometimes even in the teenage years. We also can see that adherence tends to be much worse, and kids will get lost to follow-up, lost in their cardiac care. And so any things we can do while they're in the pediatric world with all these awesome resources that a lot of the children's hospitals have, I think it benefits our patients to be able to use those as best we can.
Okay. We actually had one more question come in. I'm going to ask it. Is there utility to guided group therapy or even setting up a buddy system for teenagers dealing with heart failure and or needing a VAD?
Yeah, so always. So support groups in general are not always my favorite thing because I think they don't work great for all kids. Now, the online support groups, I think, have offered a little bit different venue, but I do recommend that if your child or teen is engaging in an online support group, really being closely involved, not to overshadow confidentiality or anything, but really being closely involved and know who is navigating that and who's overseeing it. Where I tend to see the most benefit is that buddy system that you asked about. So we have a program here that I've seen in many other hospitals that's a peer-to-peer mentoring program, or just we can connect kids with kids that have had similar experiences. It's very helpful for parents as well. And so we definitely try to do that. Pre-COVID, when we were able to get our patients together, I always think it's helpful if we can take our VAD patients to the playroom together and allow them to kind of engage in that way. Even our really young kids, just visually seeing somebody else that has the same device as them, and I think is incredibly helpful. And so hopefully we'll get back to a point in our lives that we can do that again. But definitely connecting at least one-on-one, I think, is incredibly beneficial to kids to not feel alone.
Great. Well, Dr. Gross, this has been a really interesting and informative presentation. We've had lots of great questions, which is always a good sign. So we appreciate you taking time this afternoon to present this webinar to us. We did have somebody ask if there was more information about upcoming webinars. We will. So everybody who is attended today and who signed up, you'll receive a follow-up email from us with a link where you can be able to view this recording online. You can feel free to share it with your children, your teen, your family, your friends. It might be helpful for them. And then we'll also give you more information about upcoming webinars and a variety of the support services from the Children's Cardiomyopathy Foundation. So Dr. Gross, thank you so much for joining us. And we hope everybody has a great rest of their Friday and a nice weekend.
Thank you. Goodbye.
Bye.